Hi, this is Laura Beck with the Eden Alternative, and I'm really fortunate because today I get to hang out with Lisa Kendall, who is a licensed clinical social worker and a clinical gerontologist who specializes in trauma-informed care for elders and their care partners. And so, Lisa, I thought it would be a great idea for us to get together today and talk a little bit about why this is such an important topic and why people should consider joining us for the webinar series that we're going to be kicking off featuring you as our featured facilitator in late February and early March. The name of the webinar series is Trauma-Informed Care, Making Peace with the Past. And I thought we could just start, Lisa, with maybe you defining what trauma-informed care means.
Thanks, Laura. It's good to be here with you today. Trauma-informed care is really an approach that recognizes that trauma is prevalent. It's widespread among us and the folks that we work with. It's also an approach that means we are recognizing signs and symptoms of unresolved trauma, and that we're incorporating policies, procedures, and protocols into everything that we do so that we're approaching trauma and the people who are living with unresolved trauma in a caring and compassionate way. We're also taking a look at the environment around us to make sure that what we're doing, how we're doing it, and the environment that we're living and working in is not inadvertently re-traumatizing the folks that we're here to help.
That's a great description. Helps a lot. And another thing I wanted to explore with you is, what happens when care partners don't take the time to develop this skill base or this expertise? What are some of the things that could go wrong? Maybe you could offer a couple of examples.
Well, thanks. It's a wonderful question. And I think partly it's because trauma is so prevalent. We can never be sure when someone that we are working with or caring for has unresolved trauma. Sometimes it's more obvious. For example, when we're trying to give care to someone who's been assaulted and they're just having a hard time receiving it, that might be more obvious. If we know that that's their history, we may not know their history. And then it's just kind of a mystery why someone can't tolerate being touched, and they're just having a huge reaction to receiving care. Sometimes it's a lot more subtle. So think about eating in a restaurant, or perhaps people who are dining in the dining room at a nursing home, and someone just good-naturedly comes up to the table and says, "Hey, you didn't finish your meal, so no dessert for you." It's very possible, and I can tell you that it's happening some places, that person who's had that said to them is having a really deep reaction of shame and upset because that's been said to them, and they may have a history where eating issues and finishing everything on your plate was a big issue in their childhood home. They may have been severely punished for not eating everything on their plate. It's a subtle example, but it's a serious one. Not knowing that and just making those offhand remarks can mean the difference between that person feeling welcomed, feeling comfortable, and really engaging in the life of the community at exactly the time we're trying to create community for that person and helping them feel welcome.
Well, that subtle example really hit me because I know that there have been times in my life where I was trying to be friendly and joke around and kind of be casual with someone to make them feel more comfortable, and accidentally stepped in it, right? So sometimes the subtleties can really get you. I think that's a powerful example for helping people realize why understanding the layers involved in understanding trauma-informed care is so important.
Yeah, thanks, Laura. Thanks for saying that. I think we've all done it inadvertently with good intentions, and my guess is most of us have had it happen to us as well. Learning about trauma-informed care is a way to be more sensitive, and it is still going to happen, but having an environment where we're talking about it openly makes it much less likely, or that when we do accidentally step in it, we're able to make amends and to move forward, and everybody continues to grow.
Right, being able to do it in an informed way, what a refreshing change. So let's talk about the regulations for a moment. We know that the regulatory system is moving in the direction of embracing more person-directed practices and individualized care. And so I'm curious, how does trauma-informed care play into all of this and support the organizations that are trying to transform culture?
Yeah. It's exactly the right time for all of us to be learning more about trauma and trauma-informed care. The CMS, the Centers for Medicare and Medicaid Services, has made trauma-informed, person-directed, and culturally competent care a requirement for nursing homes. But the truth is, across the care continuum, it is best practices. So whether we're talking about doctors' offices, dentists' offices, home health agencies, offices for aging, nutrition centers, the neighborhood school where our children are learning, we all need to be learning about and practicing trauma-informed care. In fact, CMS has made this an FTAG. So it's important that we learn about it, and it is relevant. It's really part of culture change. It's about changing and shifting our paradigm about this. It's one of the reasons I'm so excited to be having the opportunity to facilitate a webinar about this. It's an opportunity for us to all come together, share our experiences, learn more about what trauma is, about how trauma-informed care can be integrated into what we're already doing in person-directed care, and to figure out how to have those conversations back at our organizations so that we can continue to grow and integrate this into what we're already doing.
That's so fantastic. I am really excited about coming together again on February 26th and March 5th for Trauma-Informed Care, Making Peace with the Past. All right, everyone, please join us. Thanks, Lisa.
Thanks, Laura.